Show your age. Show your body. Show your strength. Show your edge. Show your killer hair. Show yourself. Hair biology, designed to work with your hair as you age.
So I'm really honored to be with all three of you in our own little ways, and in their case, my little way, in their big ways, they are changing the whole discussion about menopause. So let's start, Dr. Ullman, let's start right from the top. Please give us a quick summary of what is menopause. What is that magical day when menopause really happens and you become postmenopausal? What are some of the most common symptoms? And also, what are the most common treatments for menopause at this time?
Okay, I'm on, right, ladies? Okay. So I just want to set the table for this group. Perimenopause is the journey into menopause. Let's not be confused. So for those of you in your 40s, I think there was a poll. So the few 40-year-olds, I can't see you, but hi, there you are. Okay, you're in
Maybe
the
a show of hands. Perimenopause, raise your hands.
You're still having cycles, but they're changing. They're changing because the conversation between your brain and your ovaries are changing. So you're going to start experiencing symptoms just like the menopause crowd. The menopause group is you have stopped having menstrual cycles, and by definition for 12 months in a row. And that is really, consider it ovarian retirement. You should thank your ovaries for their excellent service. They have been working for 30 to 40 years. Their job is to make estrogen, progesterone, and testosterone in just the right order, in just the right amount. And you have receptors in your whole body, from your head to your toe, from your hair to your toenail, so that when you no longer make estrogen from your ovaries, all of you will suffer, right? You're going to notice the 65 million of us who are menopausal women at the minute are going to have the most common symptoms. 80% of us will enjoy them. Hot flashes, night sweats, and with that will lead fractured sleep and mood changes and brain fog and aches and pains and weight gains and no interest in sex, and on and on and on. But you'll also notice everything else. The texture of your hair, the quality of your skin, the
vaginal dryness.
Your dried up vaginas.
How to throw it in.
Right. So it really is a very significant issue that we, those of us who are in this space, I'm a gynecologist. I happen to be 57 in the house. And I always love to tell women, I'm old enough to be your doctor. I'm old enough to teach you this topic. And I'm old enough to say we just got to use common sense finally, right? So we're going to talk about strategies. I think you asked me about estrogen.
I did. Yeah,
that's
you told us some of the symptoms. And by the way, you only hit on the symptoms really when you're going through the transition, but then there are also long-term, deeper things that are happening in the body.
Right,
like
so
bone loss.
In addition to being a symptomatic person, right, when you no longer make your estrogen, which is really the key one, progesterone and testosterone are important, and this is bigger than our scope at the minute, but there are bigger health issues for women. Osteoporosis, dementia, heart disease. And by the way, I should put heart disease right at the top. It's the #1 killer of women. So that's where we should focus our energy and our concerns. Hormone therapy is a very big topic beyond the scope here, but the gold standard for the treatment of menopausal symptoms is hormone therapy. It's estrogen therapy, and there's going to be a bunch of you who are frightened because you have in the back of your mind, it's going to cause breast cancer, and I will have a heart attack and a stroke and a blood clot. So,
and if I fall, I'll fracture.
So what I really want everyone here, your take-home pearl is at some certain point you need to graduate from your beloved obstetrician who delivered all your babies and knows all of your secrets, and you have to migrate to a gynecologist only, someone who focuses on midlife women's health, someone who focuses on menopausal medicine. And by the way, you're menopausal from your last menstrual period until death do us part. So women don't actually even understand that. You're always going to be menopausal. Once your ovaries retire, you'll spend 30 or more years without hormones, without estrogen, progesterone, and ultimately testosterone. So it's a very, very big deal, and everybody needs to get educated and do, the basics, right, that I guess you want to cover for non-hormonal treatments. but you want to
I
partner.
do, before you move on to that, though, you did mention finding a new healthcare provider for this stage of life.
Right.
And so where is a good place for that? I would think North American
Yes.
Menopause Society. Do you want to share that?
I do want to just give you a couple of pearls when you leave here, things that you can take action yourself. If you're going to snoop around the interweb, and that's what I call it, Dr. Melnick, the interweb, you just want to hit the North American Menopause Society. It's just menopause.org. Just make your lives simple. When you're up in the middle of the night flashing, you can't sleep, and blah, blah. We've all done it, and I feel like I'm having a hot flash right now, Stacey, right? It's hot as hell in this room. So, or I'm having a hot flash, one or the other. So menopause.org is really the best place for the most evidence-based scientific information that, and you can find a healthcare professional. I always give that tip too. See if you can find a NAMS credentialed expert in your neck of the woods. And if not, you want to find a gynecologist who really does focus on the 40 and above crowd.
And has empathy too. I mean, how many stories have we heard about women going to doctors who just get, oh, it's all in your head.
Or it's just menopause. You'll get through it. If you're like me and you're not able to take hormones because of my health profile, I thought I was overreacting. My doctor just dismissed me, and then I thought I was going crazy because I was like, how could all of these things be happening that are wrong, and there's nothing I can do about it? I didn't know what to do. There were no other options as far as I could see besides the gold standard of hormones, and I was like, where does that leave me? I'm going to white knuckle through this. I thought, oh my God, if nobody's talking about it, can you imagine all the generations that came before us? All of these women have been white knuckling for centuries. That's some bullshit.
Yeah.
Like, we got to fix that.
That really is.
I do like the word crazy that you said, because women say that all the time. I think I'm going crazy, especially during that perimenopausal transition into early menopause. You just don't feel like yourself, and you don't know why. And that's the bottom line. So
now, Dr. Allman, just take us through briefly some of there are women, as Stacey herself just said, who are not good candidates for hormone therapy for whatever reason. So what are some of the non-hormone therapy, some of the non-estrogen, or even local, because that's systemic, of course, maybe even localized estrogen? What are some of the other options to mitigate the most common symptoms?
So really, we do have to take charge of our lifestyle choices, which, when you don't feel well, you're not sleeping, you're not apt to do. But you really do have to start there. You have to be more active. You have to exercise or be active daily. You have to eat healthfully. There's just no getting around that. You must protect sleep. You have to prioritize your sleep habits. And then for those of you who are flashing and cannot take or will not be able to or won't take estrogen therapy because you're so fearful or you haven't partnered with an expert, there are antidepressants that makes you feel terrible. I don't want to be on an antidepressant, but there's actually one FDA-approved antidepressant where the dose is so low that if you're depressed, it won't help you for that, but it absolutely helps with hot flashes, especially in our population who cannot, for medical reasons, use estrogen, let's say, for vasomotor symptoms, hot flashes and night sweats. There's local vaginal estrogen and also local other treatments for vaginal dryness, which is so important. 100% of vaginas are going to shrivel up and dry up in menopause.
And if true or false, if not treated, it gets worse. It's not one of those things like a hot flash might go away eventually.
After 7 years on average, they'll go away.
But vaginal dryness gets worse, yes or no?
And not only does it get worse, it is so, whether you use your vagina or not, it is so important to have a healthy vagina. We all have to take charge and care deeply about our vaginas. And you have to be told to do that because women don't realize, I'm not using it, so I don't care about it. And this is a very big topic.
Yeah, but a topic for another day.
There's a whole
Ann and Cheryl, have us back to talk about vaginal dryness only, and we can go on all day about it. Some over-the-counter options?
Can I talk about that just a little bit?
Go on.
Because that's the company that I started. Sorry, because there is so much about medical options that there really wasn't a lot in the industry of over-the-counter safe care that was either clean, beauty for your skin, or things for vaginal dryness. So you can use things like sodium hyaluronate suppositories, CBD suppositories. All of these things actually do moisturize the vaginal wall, but they don't have estrogen. They're not contraindicated with estrogen, but it was because I couldn't do anything And I did not actually go. I went to my doctor and I said, I have anxiety through the roof. I'm depressed. I'm going to kill all of my friends. Like, I hate everybody. The rage is real. But what I didn't like was that she said to me, well, here are some antidepressants. Here are anti-anxiety meds. You need to start meditating. I was like, stop looking at me as a bunch of problems and start talking to me as a person. Right. What can I do holistically? So when Dr. Allman says, look, we have to take responsibility for our lifestyle choices, I had to educate myself about what it meant to be in menopause, and that we're not dying at 60, we're dying in our 90s. We have a lifetime in front of us.
Yes.
So the idea that menopause is a natural transition, one that we should know all about way before we get there. I would say even in your 30s, you should start learning.
I feel like I started telling my daughters, they're both in their 20s, all about it. They read my menopause cheat sheet newsletter religiously.
I feel like you should get a talk at 40. What to expect when you're not expecting at 40 is where everybody should get a master class.
Except they're real litigious about what not to expect. But still.
We'll get back to your story in 1 second. But, we have been talking about estrogen, and estrogen really is the big star hormone when it comes to menopause, but there are other hormones.
I know you want to talk. We didn't mention black cohosh and soy products.
Oh yes, other over the counter.
So you can try all of those things. I'm just going to give you a baseline. You can try anything you want, and if it doesn't work for you in 3 months, it's not going to. Okay, so
that's great advice.
So that's it. So that's the short answer
that's
for
true
any of the.
almost everything.
Go to any health food store, and the menopause bottle for you, it's going to cure this or that. All right, if you want to spend your hard-earned money on that, go ahead. But if it's not going to work for you in 3 months, it's never going to work for you. So
yeah, the best takeaway from what this discussion just now is two things in my mind. Is one, if you have a trusted healthcare provider already who you love and is really empathetic, discuss that with him or her. And if you don't, go to menopause.org and find one who can. And then you'll also work in partnership. I'm a big believer in working in partnership with your healthcare provider. Absolutely.
Yeah, Electrohealth is it. They did the 21st Century Guide to Menopause.
Yeah, that was a good one.
And
we're talking about Electra Health, everyone, with a K-E-L-E-K-T-R-A. You can find it online, and they did a really great job with that, I have to say. But I do want to get Dr. Melnick. Dr. Melnick, so we have been talking about estrogen, as I said, but there are other hormones in our bodies that do come into play.
Absolutely.
So, and that cause a lot of mayhem and wreak havoc. Tell us what those other hormones are and what's going on, and then what do you discuss with your patients as far as treatment?
Okay, fair enough. So the first thing is that there are so many symptoms that exist and are not addressed because they don't come from estrogen. The ovary produces testosterone, and when the body doesn't produce testosterone, of course, the sex drive goes out the window. But there are other things that come, like depression, anger, anxiety. Now, testosterone, again, is a very good treatment. It's very safe, and it really relieves a lot of symptoms. I mean, some of the menopause symptoms that when you work out in the gym, you no longer get that firm muscle. Your skin becomes flabby. It's called sarcopenia. And again, this is due to lack of testosterone. The other hormone that is really related to menopause, goes like peanut butter and jelly, is hypothyroidism in menopause. Now, with thyroid, the thyroid goes off at 3 times in a woman's life, all related to estrogens. Number 1, it can occur in puberty. Number 2 is after childbirth. And number 3 in the menopause. And at the menopause time, that if someone has a pre-existing thyroid condition, it can get very much worse, and the symptoms can get much worse. So, I mean, beside the typical symptoms of hypothyroidism that women have, if it's not diagnosed, they become unable to lose weight. It gets very frustrating. Their hair becomes thin. They become depressed. They might have brain fog. And brain fog also is related to low testosterone. So these symptoms all have a hormonal origin. And it's important to address these. And the point is, you have to learn one thing, that blood tests are not the answer for every diagnosis. And so many women have typical hypothyroidism, And they, as you said, that the doctor says, you're crazy, get out of here, don't bother me, or take antidepressants, or see a shrink, or whatever. But these things don't address the problem. It just makes the person feel worse. It just makes everything worse.
Dr. Melnick, you just brought up an excellent point about blood tests. Women always say, should you check my hormones, measure my hormones? If you're menopausal, which means you're not having menstrual cycles anymore, your hormones are low. Okay, that's the end. That's the bottom line. Yeah. And we don't chase blood levels around for hormones. We chase your symptoms around. How severe are your flashes or your night sweats or whatever your symptomatology is? Or do you have osteopenia or osteoporosis, or are you at risk for that? So, and I told Dr. Melnick we were going to have a spirited conversation on testosterone. I just want to let everyone know it is not FDA approved for the use in women. So if you're going to consider testosterone, you better partner with an expert. And it really is only in the realm of sexual health. And it really is for the 1%ers. So 99% of us are not interested in sex. It has nothing to do with testosterone.
Just very quickly, I read an article not recently about how very often it's the male in the partnership who's like maybe having medical issues or
and look at that, Viagra was approved.
It's like, hey, the woman wants to have sex, but it's not happening because the man can't. Or doesn't want
what
to.
happens
But I'm just saying, that just was interesting.
When I treat women for sexual dysfunction and inability to have intercourse, they feel so good that I see their husbands about 3 months later. And to keep up with them. And I mean, yes.
Also, let's not forget, I don't want to keep going to vaginal dryness, but I think it's coming into play here.
Yes.
Because it's not just that, it's also what's happening with your actual vagina.
Sure.
If it's dry, it's going to be painful.
Right.
I mean, that's just the way it is.
And no one's going to be interested in sex when it's painful. So
No.
that's where you
No.
want to start with vaginal health,
Right.
health and wellness. And you can do over-the-counter moisturizers. Moisturizers are different than lubricants.
Correct.
Lubricants you use to insert something into the vagina. And I always like to give this clinical pearl to all of my patients. You have to be told that you have to use the vibrator, whether you have a partner or not, whether your partner works or doesn't. It's your job, women, to maintain a
Can I suggest
vaginal
Dame?
health. So you can just go to
Dame.
goodvibes or goodvibes.com or go to Amazon. There's not, everyone says, what's the best vibrator? There's no best one, whichever one you like. You just got to do, it's a once a week homework assignment that I give once a week. And I have a chapter called The Vagina is Like Las Vegas. Maybe you'll want to read Menopause Confidential, so you'll want to know why is the vagina like Las Vegas. But that's your homework assignment. When you leave here, you're going to partner with a healthcare professional who knows midlife women's health, and you're going to do your weekly homework assignment that you just got.
And you're going to go to stateofmenopause.com.
Okay, Stacy. Yes. Stateofmenopause.com. Okay, let's hear more from you on your story.
The only reason I bring that up is really because I do believe that we need options that aren't medical. Not everybody can afford that. Not everybody wants to have hormones. There are a lot of reasons why hormones, even though they're the gold standard, aren't for you. And they certainly weren't for me. And part of the reason that I felt so strongly about that was like I had the aches and pains. I had the hot flashes. I had my jowls melted into my neck. My ass melted into my knees. I was like, what is happening? And just psychologically, the two big things for me were I don't look like myself and I don't feel like myself. And the worst part was that I don't know how to help myself. And my doctors did let me down. They really did, because they weren't from NAMS and they weren't specialists in menopausal medicine. I didn't see an endocrinologist. And these were all things that I didn't realize were even options for me, because my doctors were like, you can't take hormones, so you'll get through it. So, P.S., a lot of companies, you probably heard, there are a ton of things going on in the menopause market right now that are over-the-counter products that are meant to help with the physical symptoms that are annoying. Right? Not necessarily the ones that are like really going to set you over the edge. You know, people will say, oh, you can take, natural things for depression or anxiety. I don't get into that. What I am interested in is acute symptomatic relief for some of the things that happen to us during the menopause experience, particularly hot flashes, dry skin, breast tenderness, muscle fatigue, joint pain, cystic acne. I had to buy special tweezers because I couldn't see my chin hairs anymore. They were all white and gray. And I just started to feel like I was like so bored with the fact that this was happening to me that I just started naming them for the fun of it, to be like, got you, Chester. But all of those things, it's about feeling better now, right? For me, it was in the moment. What can I do in the moment? What, these doctors are talking about is regular care and really seeing the right kind of doctor, which when I started my journey, I did not understand. But what I really like is knowing that I have a cooling spray that is made of peppermint oil and menthol oil. It does cool me down when I have a hot flash. I can leave it in the freezer, or I can keep it in my bag, by my nightstand, in my medicine cabinet, and it's there. So if it happens, there is something to do in the moment. And Dr. Allman, what you were saying about supplements, this is my problem. No matter what supplement, whether it's medication or supplement, the onus is on us. If you miss a dose, if you don't take them correctly, if you're expecting immediate results, that's not what happens. So I wanted to create a company that gives you immediate relief from certain symptoms. Of course, this is the other problem, right? The FDA considers menopause a disease, and there are 2 recognized symptoms, hot flashes and vaginal dryness, but there are 34 common symptoms that we see in menopause, and those are not being addressed. And they're not being addressed unless you're taking hormones, and they're certainly not being addressed in commercial markets yet, because the FDA says you can't make something that's over the counter. So there's a lot of legislative work to do around menopause. We've seen so much advocacy around pregnancy and postpartum and infertility, even talking about puberty and periods. Gen Z is like talking about their periods. I'm like, good for you, talk all about it. But I want to talk about like how much money I save from not having to buy tampons. And I bought these great earrings, you know what I mean? But I think the other big thing that I would say that is just aside from the best health practices is that we need to reframe the idea of menopause. It is so time to be over it as like, it's misery, you're past your expiration date. Yes, there is some loss and grief, I think, about maybe not being able to have biological children anymore. Maybe not.
You can have mine.
Right, okay, well, there you go. But maybe you couldn't have children even before menopause, or maybe you didn't want them like me. Like, I'm happy to be a dog mom. But did I feel like, oh, my body can't do what it did for the last 30 or 40 years? Sure, it's nice to say thank you, ovaries, for your hard work, but there's no AARP card for them. And
so you're tying it directly into aging, which is what most people do.
Well, there's chronological menopause and there's surgical and medical. But I think that regardless of when you're experiencing menopause, we associate it with aging.
Correct.
And then we really kind of do this internalized shame, patriarchal view of what we're supposed to be as women, all of this stuff that I think really clouds our way of moving forward, and certainly our way of taking smart medical advice, and certainly also finding other healthcare practitioners that can help us through this. But you're not crazy. You're not. This isn't hopeless, and you aren't helpless. It's just I didn't know that. I started a company. I took my crisis and started a company. That's what I did. And
That's what smart women do.
Right. But I believe that this is a much bigger topic than just like all of the medicine around it. It's the cultural relevance of this.
And you also pointed something out, that there are quite a few new companies in the space of menopause now, which is a very good thing. Because
it's an excellent thing. In 2 years, we're going to have
more voices.
Well, in 2 years, we're going to have
elevation.
In 2 years, we're going to have 1 billion women in menopause. That's 12% of the Earth's population. The billions of funding.
We're going to need a lot of that peppermint spray that you were mentioning.
Talk about global warming. Yeah, it's not kidding. Well, we sell a 3-pack. So anyway, but that's a little bump for the company. But really, more importantly, is that you're going to have 12% of the Earth's population in menopause. 52% of the population goes through this, and yet you have billions of dollars invested in things for erectile dysfunction and hair loss in men, and less than $100 million in funding for menopause. That is what has to change. Both clinical research and products.
Absolutely. Thank you for that too. Great discussion so far, but I now want to open it up to questions from all of you. I'm sure you have quite a few. Right there in the front row.
Tell us about the pellet treatment.
Yes.
Because we're on those topics, you might as well let ladies know what you're doing.
Yes, okay, I certainly be happy to. Okay. The pellet therapy is a different form of medication system, not a pill, which, again, testosterone and estrogen may not be the best way to take those hormones. So the pellets are natural bioidentical hormone pellets about the size of a large grain of rice. And the dosage is calculated from blood levels and size. And what I do is I use local anesthetic and put them underneath the skin in the buttock area. And they last for 3 months. And it supplies estrogen and testosterone. And again, clinically evaluate the patient after 3 months. Let's say if she's still having a little bit of hot flushes, I'll raise the estrogen, or if her sex drive is not controllable, then we'll decrease the testosterone. And
Why would you want to do that?
Pardon me?
I was teasing. Why do you want to do that?
Well, I don't know. You tell me. But it seems it has all the safety advantages that the other forms of treatment do not have. And testosterone on its own can be used even with women who've had breast cancer, because again, what was the initial treatment for metastatic breast cancer before they had all these fancy chemotherapies? It was testosterone. Women tolerate it well, and testosterone really makes both men and women feel a lot better when you're older, and I can swear on that. And
I gotta be the counter voice to this, and I want everyone. I'm gonna say it nicely and slowly, Dr. Melnick. It is not FDA approved for the treatment in women. We do not, on a regular basis, consider pellet therapy. We do consider testosterone therapy. It's for a tiny percentage of you, and you really, really have to understand that there's no science for the use of testosterone. You can't say that it's safe in women. You can't say that it's safe for breast cancer survivors. You actually cannot say that. So I'm going to say that out loud. I know, Dr. Melnick, this is one of the things that you specialize in, so we're going to have a little controversy on the panel.
Yes,
But I'm up
controversy
for it 'cause
alert.
I'm a New York City girl, and that's just how it's going to go down. So,
we're going to have to go head to head on this, because there's definitely a major disagreement.
Yeah,
And
this
there's-
is the reason why we
Yeah, sure.
invited both up
And-
on the stage
and-
together.
and at first,
Because
you know,
we knew that there was going to be some difference of opinion
And-
on that. Yes, please, in the back.
Okay, so, I'm from Brooklyn, so now you're gonna get a little.
Brooklyn.
Flatbush.
All right, I had twins at 57, so I never went to menopause. If you want to do that, you can converse. But anyway, I went to Dr. Melnick, and the thing that was interesting for me, and this isn't, you know, you have to decide whether you believe in testosterone or you don't, but I would always use a cream, and my numbers were still low. And Dr. Melnick pointed that out, so I'm trying the pellets right now. I'm in my second month, and I'm feeling much stronger and that it's integrated in my body. So I'm just saying that from my experience, the creams that I was using, the bioidenticals, were not really absorbing into my system. And of course, I'm an energy healer and life coach, and I'm into nutrition, so I'm doing all the supplements as well, but they still weren't working. So I'm going to be very interested to see what my blood work is by the 3 months.
And it's great that it's working for you too. And and that's a big part of this is that I think we said earlier on in the conversation, you have to try something. If it's not working in 3 months, then maybe you kind of kick it to the side. So,
I'll tell you, I feel much better. I definitely do.
that's good. That's really, really good. And even though it's not FDA approved, I
one
said
word
that
about
there are
that.
anecdotal stories from users, from men and women, I'm sure, who have had good experience
Well,
with
the
it.
FDA is not the end all and be all.
This is true, too.
Believe me. And for those
I just
folks
got
who
a
approve
PRP
the
injection, and that's not
right.
FDA approved either,
right,
and it
but
worked for my
it's a
hip.
natural product. But for the folks who approve the vaccine, just give them a hand. If you
What
believe
other
anything they
questions
tell
do
you.
we have? Any other questions out there? Yeah, please.
On a very opposite side of what you're talking about, and much like the panelists before, who talked about when he was 90, he started talking about the Holocaust. I don't know if you were here before. But I'm wondering if you have either treated or know of, or whatever word you want to use, PGAD, persistent genital arousal disorder.
Is that
This is
something that
directed-
happens in menopause?
Is this directed to Dr. Melnick? Or
Well, I've actually heard about that now that you bring it up years ago, And for the life of me, I'm having a senior moment, and I can't remember what the treatment is or what the etiology is. But it does exist. I'm sure if I read about it.
Tremendously. And I don't know if anyone in this audience suffered the way I did, but it is called persistent genital arousal disorder.
Mm-hmm.
And there are so few doctors that address this.
Okay, so I'll give you a name if you want on the
No, I
small.
don't need a
You don't
name.
need. Okay, so everybody here. Does anybody else need? Does anyone else?
Anybody
need a
else
name?
have the problem? And Dr. Allman has a name.
If you have sexual health issues, there's one doctor on the small island of Manhattan who is the best one. Her name is Dr. Sharon Parrish, Parish. So for those of you who are having issues with sexual health, that's the person you should go to. End of hard stop.
Questions?
Over here, yes, please.
You talked about hypothyroidism, and both my aunt and my mother had that. They've been testing mine since I was a kid because I've always been overweight and I have all the outward symptoms of it, but the blood test won't show it. And I heard you said, well, the blood tests aren't the answer.
Exactly.
The total answer. What is and what can be done? Because the extra weight for my life. I've been active. I've done 50-mile bike rides a lot, but it's now trashing my knees, my hips.
Sure.
It's getting bad.
Well, in my opinion and experience, that the symptoms are really much more telling than the blood test, because blood tests often, 40% of the times, will read negative when the patient actually has hypothyroidism. So, if it looks like a duck and walks like a duck and quacks like a duck, it's a duck. And if you have all the symptoms of an underactive thyroid, you deserve to have a therapeutic trial of thyroid medication. And I would say a good percentage of the time, 80, 90%, people will feel better.
So you would do that because in the past my doctor would give me Synthroid and then I couldn't sleep.
Right.
But we don't know the amount.
Well, I don't particularly endorse using Synthroid on every patient, and I like the more natural, old-time thyroid medicine, Armor Thyroid, since been.
The armor, but I don't know how much
Well,
it did work. So I don't.
you have to know how to work the dosage with Armor. It's different than with Synthroid.
Question? Yes. Over here.
I have a very simple somatic question. Some of you use the phrase postmenopausal, and yet Dr. Ullman said you're menopausal for the rest of your life. Is there such a thing as postmenopausal?
So that's what women think. I'm menopausal when I'm having flashes, but when I'm all done with those flashes, then I'm postmenopause. So thank you for bringing that up. You're menopause till the day you die. So that's just it's out there in the lay press or in our lexicon, but you're never postmenopausal at death. You're postmenopausal when you're at death. But you're menopausal from your last menstrual period until the day you die. So you're never post, but the women associate menopause with being symptomatic. I've got flashes and sweats, but I'm all done with that menopause now. Women say that to me all the time. Yeah. I'm all done with that menopause now. But you're not all done with that menopause now. And the big ticket issues are heart health, bone health, and brain health. So focus your energies there to get smarter about what you can do, as simple as eating more healthily. Again, I keep saying that, but you're not doing it. I know you're not doing it, and so you got to do that, and you got to protect sleep, which we don't talk enough about. But I'm in
third
bed by
pillar of good
9
health.
o'clock. At 9 o'clock, I'm
9?
9 o'clock is my bedtime.
Yeah,
Maybe she
I'd
did
like
your
it to be
thyroid
9.
check.
I like
It's
to
10.
think about the postmenopause thing as
Yeah,
like
I want
it's
to
the,
address that too, but please, Stacey. you
Yeah,
go
I was just going to say, if you think of a highway of your life, right, this is the last exit before you're 6 feet under, where you have the opportunity to really safeguard what your health is going to look like for the next 40 years. If you are thinking about postmenopause as, hey, cognitive, and bone and cardiac health, you are going to live a whole lot longer than somebody who's not paying attention to those things. Yes. So this is an incredible opportunity that I think we again need to reframe the way we're looking at it. We can bitch about it all we want, but it's still going to happen. So how do we manage it in a way that actually makes us feel like we're proactive and in charge of what's happening to us?
Correct. And also, I'm a big believer in trying to age successfully. Ever since I turned 50 and had my own menopause experience, and then wrote my first book, and then that's what I do now. I write books about healthy and positive aging, and give talks about it, write about it, and you know, it's so important. I now know all the science shows that you have to get yourself set up now during this period to really age better, to age successfully, as our panelists were just saying, and Stacy was just saying about the postmenopausal thing. I think I'm going to differ with you slightly on that because I'm a writer. I am not a healthcare provider, a clinician, and I like to make things very simple for my readers and for myself because I am my reader. And so for me, it's perimenopause, all the, you know, the estrogen levels fluctuating, and then your hot flashes, and then that day, that magical day when you haven't had a period for 12 months, and then the next day, you're postmenopausal for the rest of your life. And that is how I present it and write about it. Just sorry, forgive me.
That's okay.
Forgive me, I'm
forgiven.
sorry,
You're
but
forgiven.
Well, you were actually following the letter of the law by these renowned societies who don't get it right half the time. And, you know, that they said that you're not menopausal, you have to not have a period for a year.
Yeah.
And that's ridiculous. 10 years before that, that's when you're having your symptoms.
Exactly right.
But-
and when I hear the term menopausal, I still think I'm going through it.
Yeah.
So that's how I personally
Right.
differentiate it.
Well,
But
just
thought I'd add it
just
in.
one
Menopause
point.
really is the end of your reproductive life. So that's
Yes.
the
If
short
If
answer.
I make
You're
one-
no longer reproductive.
If I make one important point,
Yes,
though,
of course.
that even if you haven't had any kind of treatment, and even if you have something like osteoporosis, it can be reduced by testosterone treatment, and certain type of thyroid medication has this thing called thyrocalcitonin in the natural armor thyroid, which again builds new bones. And we see patients all the time being treated with this. Their bone densities get better, and they don't suffer all the complications of the osteoporosis drugs.
now I'm going to be on the other side of that. I'm on the board and have been for many years of what was formerly called the National Osteoporosis Foundation because I have low bone density thanks to menopause. And but I've done everything right so far to keep it stabilized. Thank you. A little round of applause, and that would be so really welcome. It's not easy. And it is now called the Bone Health and Osteoporosis Foundation. We changed it this year. And that is not at all the recommendation that
I know
we
it's
have
not-
given.
it's
Never,
not the-
like
it's
never,
not-
never.
it's
I
not
just
the
want to,
recommendation,
it's important because I feel like
because they've
I'm
never
on the
seen the
board
data
of
on it.
the source of information
And
about
osteoporosis is a
osteoporosis.
pandemic, and everybody knows what that big
Right.
word means now. So take it very seriously. Take your
Yeah.
bone health
It
very
is so
seriously.
so important. You know, your new motto before I get the other questioner is don't fall, don't fracture. So not only do all this great stuff, but balance practice. Just do it. Standing on the phone, even right now listening to us, you could stand up and balance on one foot and switch over to the other. It's really easy to do. You don't want to fall and fracture. Okay, a question? Yes.
I always kid Dr. Melvin and tell me that he is the longest male relationship I've ever had. I think 1981, maybe 82. And he's just been great. I mean,
Well, he is great.
oh, he's lovely. Anyway, so for armor thyroid, all I can say is it's the bioidentical one, right?
Yes.
The thing is there are health plans that didn't cover it. And so I had to try the Synthroid, and I had to try the levothyroxine. And my hair would fall out, and I'd be cold all the time, and I'd gain weight. And it wasn't until I went back on the armor thyroid because the other ones didn't work. Of course, Medicare won't pay for myself. But anyway, he's right. Just if you take these fake ones, it might not, like for me, it might not work for you. So you might be better off taking, I would say, now it used to cost me about $50 a month, and it's gone up now. It's just a little over $100 a month, just because they can.
Right. And also, there are all of these people who are, you know, desperate for that kind of medication who can't afford $100 a month. And this is, again, where I think legislation and insurance
big
are
gap.
really going to have to change. We really have to look at this stage of life differently. The same way there shouldn't be, you know, a period tax, please. Tampons should be free, right? I mean, there's so many things that I think about when it comes to the lifespan of women's health that make it so much harder for us if we don't have great insurance, if we don't have the health profile that allows us to, you know, use the gold standard that these doctors are talking about. And there's a lot of kind of equity work to do around that, both gender-wise and sort of economically.
Are you giving us another thing on our to-do list here, Stacey? Because we're busy and exhausted.
Well, you gave them a list. I can give them a list too. Take
My
what you
homework-
want. Pick
my
and
homework-
choose. It's
my
a
homework
buffet
assignment
table.
was fun. Once a week. Takes 10 minutes. Go ahead.
I also didn't know.
Testosterone is that I was having, let's call them difficulties, and he gave me some testosterone pills, which really didn't do much for me. But then he gave me a special, the pharmacist has to make it for you, testosterone cream put down there. And
You can say it, vagina. You can
say it. Say it. No,
Clitoris. All right, cool.
And that worked. I mean, he's wonderful. You almost be competitive.
Are you a plant? No, I'm teasing. I'm teasing you.
I think a lot of his fans are in the audience.
Awesome.
Today. Yeah, that's great. One more. I think we have time for one more question, or one. There was someone right there holding up her hand, and we'll get to you too. We'll do a very quick. Yeah, Ed.
So my question is, can somebody address a belief that I have that an orgasm day keeps the dryness away?
What a day?
An orgasm.
Doctor away.
Well, Dr. Allman said it before, at least once a week.
An orgasm a day does not keep the dryness away, but it sounds like you got some extra discretionary time on your hands.
Good one.
I'm sorry. Did you finish your question? I'm sorry.
Yes, I did.
That was the question. So.
So,
Okay.
but if
It keeps your vagina healthy.
If you use your vagina, it will continue to do the work that vaginas are. Vaginal cells make moisture when they're given the tools to make moisture. So you're either an over-the-counter moisturizer, something as easy as olive oil. You don't have to get the extra
Coconut
virgin
oil.
Right. So you don't want to put every kind of oil in your vagina, but there are some FDA. There are some scientific strategies
peanut
that
oil.
you can do. And local vaginal estrogen, there are other products that you can use vaginally to help. So if you're using your vagina will be delighted. And you don't have, it's not about sex, it's about vaginal health. And by the way-
Exactly right. Think about it that way.
And also, just a plug for bladders. The bladder sits right on top of the vagina. They ride together. So when you improve vaginal health, you're also improving bladder health, which is such a big deal as we women age. And
Yes.
or you don't know.
Yes.
You don't have to stick it all the way inside your vagina. You're just
But you can.
moisturizing the tissues so that it's more comfortable and less dry and irritated.
Right. We have time for one more
no,
question.
Sorry, just want to say
Go
one
ahead.
thing in relation to all of that is also, again, I am a student here. Like I started this because I was so lost and had no information and no good doctors. I'm going to start going to Dr. Allman now. But
We became friends 5 minutes ago.
but basically, I didn't know that a pelvic floor doctor existed or if I should see one. I didn't know anything about prolapse. I didn't know
Oh
anything.
yeah, we didn't even mention
Yeah.
Kegels.
So right. So I don't want to get too far into that. I'm just saying there is so much, like you could see a pelvic floor doctor once a year, like you get a checkup. If you are concerned about your pelvic floor and your vaginal health, I think it's super important.
Anne, no question from Anne? Is it a quickie? Quickie.
Follow-up, Dr. Melnick, can you tell us about the big O shot? And I wanted to ask Stacy, since we're dishing, what you think about celebrity entry into the sexual market, i.e. Gwyneth Paltrow and Goop.
Oh yeah.
I have a lot to say.
Yeah, I'm sure you do.
Stacey, why
but
don't you go first? Sounds more interesting.
No, because I know that we're out of time.
2 minutes.
So.
We have 2 minutes. We have 2 minutes.
Well, the O shot is platelet-rich plasma injected in certain areas of the vagina called the G-spot and also around the clitoris. And that helps people who had previously been able to have orgasms but lost that ability. If a person has never been able to have orgasms, it will not be of any benefit.
Thank you. All right. Thank you so much, everyone. A big round of applause
I'll answer it off.
for this trio of incredible experts
Yay.
and entrepreneurs and with such great information. Thank you very much.